Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome again to the Path You Take podcast, where the path you take is the path you make. Alhamdulillah, today I'm joined by respected Dr. Nasser Zaidi. Assalamu alaikum, doctor.
Assalamu alaikum.
Thank you so much for joining us today from your busy schedule. We do appreciate your time, alhamdulillah. So tell me, doctor, what is it exactly you do?
I am doing like spiritual care. I'm spiritual care practitioner, spiritual care professional in Fraser Health. And in Fraser Health, there are long-term cares. So there are five long-term cares that I'm covering every day, different long-term cares. So our elderly people are there. Sometimes they have dementia, sometimes they have Alzheimer, and some so other aspects are there. So I am providing this spiritual health to them.
So when you say spiritual care, what is it exactly? Can you give us like a quick introduction of what spiritual care is?
Yeah. So spiritual care, when we want to define the term of spiritual care, so there are two components. One is spirituality and the other is spiritual care. So if we don't understand exactly the meaning of spirituality, then we will not be able to provide spiritual care to anyone. So this is why it is important. First of all, spirituality, when we talk normally, we have understanding of this terminology, but maybe deeper understanding is required. So spirituality is actually our inner strength. So our inner strength means that we have a source of strength. For example, these are related to our connections. So these are the basic principles, and then if you have them, then you can overcome your crisis. So this inner strength is above material realm, because we are living in the material world. And specifically when we see that all the options which are material, for example, doctors are not able to do anything, pharmacists are not able to do anything, and others. So then you have no other way except to connect to your own inner strength. And once you have connected, then you will be able to overcome your crises, your difficulties, your hardships, and illness and sickness, whatever you have. So this is related to spirituality. But spiritual care is very professional aspect of spirituality, that you, first of all, we are trained for this one, and 3 years we have to study in the hospitals, and then which is called psycho-spiritual education. And this psycho-spiritual education, we need at least, for example, masters in theology for the acceptance of this program. And then there is a clinical, lot of clinical work is there. And then this is called experiential knowledge and action and reflection. So spiritual health education is little bit different from the education in the universities. It is very clinical, very experiential, and all the time you are experiencing, and then you are facing lot of challenges as well. So spiritual care is actually, we are, as a spiritual care professional, we are evaluation, we establish good relationship, and then we see that what are the strengths and sources of strength, and then we make our assessment whether this patient or resident is understanding his or her inner strength or not. If not, then this is our art and our skill to connect this our patients to their inner strength. Once they are connected to their inner strength, they feel comfort and they feel peace and tranquility of heart.
Okay, so Just so I get a good idea and I make sure I'm understanding it properly as well. So when you say inner strength, you've said that quite a few times. Um, would it be safe to kind of say an inner type of energy per se, like some type of energy you're trying to connect them with? And also, I'm finding a lot of overlapping similarities when it comes to psychology, counseling, therapy, building rapport with the patients. That's what you said a lot as well, and a lot of hands-on work. Um, but are there any similarities between spiritual care and religious care? Or are they completely different?
So you basically you are mentioning two different aspects.
Okay.
So maybe two questions I would
Yeah.
say. First of all, related to what distinguishing us from psychology or psychiatry or counseling is our the way we uh, the way we interact with the patient is totally different what actually psychologists are doing. So their interaction and their connection is head to head. They are working with the thoughts and intellect,
Yeah.
but spiritual care professionals are establishing heart to heart
So
relationships.
it's a deeper relationship.
It's very deep. It's very heart to heart relationship, and there are, for example, lot of foundations, principles, and learnings how to establish this kind of relationship. When you are establishing heart to heart relationship,
Yeah.
so then other person or patients or your client or your residents, they are expressing some deeper feelings with you, and they are not sharing these feelings with anyone else because you have established very deep relationship with them, and through this heart to heart relationship you are providing safe space to them. Once they feel safe, they are expressing themselves.
Yeah.
And this is the very important this is a very important goal
Yeah.
in spiritual health. So other part was related to like
Differences, similarities between religious care and
similarities
spiritual care.
with the religion.
Yeah, religious care and spiritual care. How are they similar or different? Like,
So yeah, again, and this is a very important question. Uh, Basically, spirituality or spiritual care, this is above religion.
okay.
For example, we are not there to provide spiritual care to only those who are religious, who are Christian, who are Muslim only. No, we are providing care to each and every person.
So it's not orientated to a specific.
No, they can be agnostic,
Okay.
they may be atheist, they may be anyone, because spirituality is always there.
Yeah.
People may know about their spirituality or may not know. Maybe they are claiming we are not spiritual, we don't want to see you. But actually, when you sit with them and explore their spirituality and connect them, then they will understand, oh, yeah, we are also spiritual. So, the second thing is, but religion is very important source of spirituality. For example, someone is believing in God, other person is not believing in God. So there is a big difference between these two types of people, because they have something very strong principle in their heart and in their soul, and if they are connected to their God, then they can easily overcome. For example, if you believe in God, it means that you also believe in the life after death.
Yeah.
So for example, if you are a dying patient, or this is your end of life situation, and then you also believe life after death, and you, because you already believe in God, so you can easily handle the crisis at the time of end of life. And I have seen practically in my whenever I'm going to provide spiritual care in the palliative cares, and I am seeing end of life patient, so I have seen that if they are religious, even if they are Christian, if they are Jew, uh, but they have kind of religiosity, they believe in God, they believe in the hereafter, they believe in the peace and comfort in the day of judgment. So they are very different.
Yeah.
They have less fear than other people. They are more fearful because they are thinking that we are going to be vanished. So this is the difference between religion, uh, and then we explore uh, and then this just want to mention that every person, I mean, whosoever is religious, maybe Muslim, it doesn't mean this person is spiritual also. For example, I have seen in my practice that people are they have firm belief in God,
Yeah.
but they are fearful of death, because two things are very different from each other. Mentally, we may have good belief system. We
Yeah.
may be believing in the day of judgment or God and prophets and imams, but actually we are not connected, because if God is not present in our life, if the fear of the day of judgment, for example, yeah, our connectedness is not there, so then it's not helping us. In when it comes to religion, comes to spiritual health,
Mhm.
then practical religiosity is important, not theoretical. Unfortunately, we have mostly theoretical religiosity, but at the time of crisis, we don't understand how to get benefit from prophets, from God, from the Quran. This is another art and another skills that we are going to use, and for our patients, those who are religious.
I was gonna ask because I feel like you kind of answered anyways, but when you're saying everyone has that spiritual energy within them, I was gonna ask if those who are religious, is it easier for them to channel in that and connect with that type of energy, or does it vary from person to person?
No, it is easier. I mean, there are two levels.
Okay.
So I mentioned that one level is what kind of religiosity you have,
Yeah.
whether you are practically, for example, feeling the presence of God in your life and you are already connected to, and then you feel less pain and suffering.
Mhm.
But if your religiosity is just for like ceremonial or more ritualistic, then then it is not very much helping you. But again, for both types of people, because they are religious,
Yeah.
it is easier for us to work with them, because but unfortunately we have not seen our religion from spiritual care or spirituality point of view.
Yeah.
So this is why we are not taking benefit from our belief system or whatever we are believing in.
One of the questions I wanted to ask as well was, I feel like you kind of answered it a little bit, but having maybe a full answer would be a lot better. Is if someone is religious or more religious, is it easier for him or her to find that spiritual energy compared to someone who's agnostic per se?
Yeah, there is no doubt in it. When you are religious,
Yeah.
so you have more strength, you have more energy, and you have more powerful tools in your hand, because it is in addition to whatever other people have,
Mhm.
but you have another aspect which is your religiosity. So this can be your power. So, for example, if you believe in God, and other person, patient, or client is not believing in God, so there is a difference between these two, because at the time of crisis, you can use this principle or your connectedness to God, but other person cannot. For example, they if you believe in God, then you believe in the life after death as well. So at the time of death or at the time of like end of life,
Yeah.
so you will have less fear, or at least if you are fearful, we can connect you to your God or believing in the day of judgment, because you are a religious person.
Yeah.
And I have already done in my practice lot of time that when I am reminding my patients that you already have a very good belief in the day of judgment, you believe in the continuity of your life, and you do not believe in like you are going to be vanished. And so this is very positive. And then we are again asking them, okay, tell me more about what kind of belief system you have. So if you are a religious person,
Mhm.
you have strong uh, spirituality, and if you have a strong spirituality,
Yeah.
then it is easier for us as a spiritual care practitioner to connect you and take benefit from your strength and sources of your strength, basically.
MashaAllah. Um, Now when it comes to spiritual care, again, this is one of the first times that I had more of an in-depth knowing of what it is exactly before this and before having this conversation with you. I've heard a little bit here and there. Now, my question is, what is the importance or level of importance that our seniors should be aware of what spiritual care is? And my second question alongside that is, how do they prepare themselves um, to strengthen that spiritual energy?
Yeah, so very important question. So first of all, I would like to say that spiritual care for seniors is more important because their level of distress
Mhm.
and level of discomfort is very high, and they have the same needs, spiritual needs and distress, as ordinary patients are there, but there is a more intensity. So they are more in, because they are going through very difficult time.
Yeah.
Different kind of complicated feelings are there. They are feeling alone. They are feeling isolated. They feel that they are burdening other people, and this is very strong feelings and difficult. Even if family members are around,
Yeah.
so they are thinking that I am a burden for them, and this is difficult time of the perspective
Yeah.
when we see this one. So they are also feeling loneliness. They are feeling something kind of fear of death, and this is very strong, and maybe they are feeling guilty. So
Yeah.
feeling of guilt is also maybe there. Maybe they are also thinking about their religious life. They might not be satisfied with this one. They may need to know whether they are forgiven or not. Forgiving aspect is important. Or similarly, for example, when they are feeling guilty, there are underlying strong feelings. So they have unresolved issues.
Mhm.
So uh, their spirituality and spiritual distress is very strong, and then they are really in need of our support as compared to ordinary people or other patients.
So, how, before I go to the next question, we continue off there is, you said support, right? So how do we give them that support? Obviously, you're a professional yourself, but our seniors, inshallah, most of the time are surrounded by family, of course, which is a very strong and important support system. So, how can we, the family members, practice some skills perhaps to give them better support or give them a
Yeah.
certain level of spiritual care that is, safe to practice at home?
Yeah. So first of all, it is very important to understand actually what they are going through. So little bit, I would not say you can make assessment, but screening is required. So you understand actually the senior at your home, actually what going through, what may be the issues for, because it is related to actually what is the distress level and what kind of distress is this.
Mhm.
And then, but normally, if generally I speak, so you can do a great job. Uh, we need to appreciate them. We need to acknowledge them.
Yeah.
We need to pay attention to their achievements, and they need to feel heard as well. So, your deep listening, your reflective listening, your active listening is important. Your compassionate presence is very important for them. Sometimes only your presence is extremely important. Sometimes you don't need to speak to them. Let them speak to you. Let them express their feelings and emotions for you. And then you encourage them. This is very
Yeah.
important. You are encouraging them. You are providing safe space to them. And they should really feel that you are for them, and you are fully, wholeheartedly, you are focusing on your seniors, and you are really sitting there to listen to them,
Yeah.
or you are taking interest as well. And we should not forget that they may not be able to sometimes express their feelings because of dementia or other things,
Yeah.
but they have strong feelings and emotions. They are internally realizing whatever you are doing, the way you are interacting, they are understanding. So we should not just overlook this aspect that, oh, they are not connected, they are not understanding, they are so old. No, not like this. They may not be able to, for example, display their emotions, but they are going through very deep feelings towards you.
Mhm. And then my second question was, that I asked before, um, was are there certain ways we could practice skills at home, for our elders, of course, to help kind of strengthen their ability to connect with their spiritual energy?
Yeah, so first of all, I would say sometimes it is extremely important that we learn to present for others. How I can make my presence for my seniors or whosoever I am supporting.
Yeah.
This is very compassionate. So I am feeling the pain and suffering of other person, and other person is like patient or senior or your parents or whosoever at home. They really feel that you are giving enough time to them,
Mhm.
and you are actually and genuinely, you are interested in listening to them.
Mhm.
You're deep listening and you are facilitating them. This is just like patient centered approach we are
Yeah.
using. So patient centered approach means that we are not imposing our own thoughts in our belief system to on others, but we are finding their own strength and we are facilitating them. We are uh, playing the role of facilitator. When we are facilitating them, when we are acknowledging them, we are validating them, and then they have their achievements, they uh, have done a lot in their life, but they feel alone. Lot of people may be around, but
Yeah.
again they are feeling loneliness. Why? Because their mental level is different from people around this person or senior.
Yeah.
So you are paying attention to listening to the life stories and then picking up the themes which may be related to kind of achievements and contribution. So many people are there who have contributed a lot, but they are feeling very alone because nobody is taking interest
Yeah.
to listen to them. So, when we are saying reflective listening or deep listening, it means that normally what is happening, for example, you are talking to me, but instead of listening to you, I am thinking then how to respond to you,
Yeah.
how to answer you, and or I'm not interested what you are saying. I'm interested when my turn come and I will speak to you.
Yeah.
And this is very wrong. When we are deep listening being, that I am not judging you at all. Number one, when I am listening to you, it means I have firm belief and genuine belief in the fact that you are also able to offer something to me. I can learn from you. For example, at home when seniors are there, so I am also, for example, uh, father. My kids are there, and I also see in the community. I'm providing. I'm a spiritual leader of the community. I noticed that uh, we have lot of experiences, but our kids are not taking interest. They're listening to everyone,
It's
not
important.
listening their own
Mhm.
parents. So we cannot share our experiences. And we are even saying this one that you are doing wrong. They don't listen and don't accept this one.
Mhm.
So what does it mean? It means that they will suffer in future,
Yeah.
but we are also suffering because we have, at least if you don't want to accept, at least you should acknowledge, you should listen to them, you should think about this one, so they will feel relief. So this is also very important. And reflective, just I wanted
Yeah.
to last thing, uh, that sometimes our seniors are there, they cannot express themselves. So if we want to learn to support them, we should help them to express themselves. We should give beautiful words, feelings, emotions. The language of feelings and emotions is very difficult for every person. So we first need to learn how to express our emotions, how to understand our emotions, how to label and name our emotions, then we will be in a position to help our seniors at home to be able to express themselves, because we are facilitating them, we are helping them, we are articulating whatever they are saying, and then we are repeating them. Why we are repeating, reflecting, so that we are basically asking them whether I have understood properly what you are saying or not. So these kind of things are important.
I find that very interesting what you're saying. A couple of the points what you said. Um, what I want to mention or touch base on first is when you said there's, our elders, whether it be parents or grandparents or uncles or aunts, they have lots of knowledge and experience because, they've been through life for many, many years. And then we have the youngsters, yeah, ages from the early teenagers to almost, young emerging adults where, they don't want to take those experiences. They don't want to really engage with too many of those conversations. It's almost knowing them on a first name basis. You come in during, the celebrations or, whenever there's a, party or wafat or masjid or whatever it be. You're there, you see each other, you hug, but you don't really know each other on a deeper basis.
Yeah.
That's a big thing. I find myself guilty of that too. Like one example for myself is it's only within the, the most recent past, which is most recent past 5 years, that I really started to ask my grandparents, some really deep questions about their past and, how they, for example, how my grandma got to meet or marry my grandfather, what were some challenges she went through her life and, what are her experiences and some advice she'd like to give me. And then that's when you see how passionate they are, when especially when they get so excited and you see that certain level of emotion as well, whether it be the excitement or the anger or, maybe perhaps they start crying. I think that's a healthy emotion to let go
Exactly.
because
Yeah, no doubt.
they've been holding it for so many years, and then you're just helping them kind of just release that tension a little bit,
Yeah,
that
yeah.
understanding.
Yeah, you did really great job, especially when you are also witnessing their emotions, their feelings, their response, and then reflection of whatever you said. It means that you touched their heart. This is what spiritual care practitioners are doing, because if you are touching the heart of your patients and they start to, for example, they are becoming tearful or they are starting to crying, for example, they are crying, and then it means that it is very important that you have done. And especially one thing that I you have already done successfully, but normally we are thinking, okay, so we have already said we our presence was there and we were also listening, but we should not forget one aspect, that we have to see our performance from their perspective,
Yeah.
as you mentioned about their emotions, their feelings, the way they were expressing. They should feel heard.
Yeah.
This is very important. They should feel listened, that you are genuinely listening to them, and then you are really taking benefit from this one, and you want to change yourself. And then, yeah, this is very important. Yeah.
And when you said that you actually listened to them, as you said before, um, we already spoke about this a little bit before as well, is that, I'm psychology major, minoring in counseling. So inshallah, hopefully going into a psychology
Sure.
counseling
Yeah.
career in the future, inshallah. But active listening it's a big thing to actually get them to feel that they're heard and you understood what they're saying. And one of the big things that I learned through all my years studying counseling and psychology was, paraphrasing what they said. So when they tell me, their story, I kind of just reiterate the story a little bit in my own words, just to make sure that they know I understood the story. They knew I was listening and they know that I'm not judging them.
Yeah.
The past is the
Exactly.
past.
Yeah.
I'm just making sure that I understood, okay, this is what happened, and this is how you feel about it. And I feel that way too now. It's like,
Yeah.
as if I was there myself. And also kind of following up with those conversations is a big thing, I feel like.
Yeah. So you are, what I want to, if I want to summarize whatever you said, which is excellent. And then I'm really surprised that you have a good awareness even. Um, I would say that when we are listening to our seniors or whosoever, for example, we are providing
Mhm.
care, uh, we are actively engaged. This is not one-sided issue
Yeah.
that, oh, I'm sitting and listening like idle, but I am engaged. I am reflecting. I am giving body language is extremely important here. So with your body language, you are letting your seniors know, your parents or whosoever they are, that you are really, you are happy, you are interested, you are learning something. And then uh, sometimes you are able to connect to your own experiences as well. So yeah, this is all this great. This is what we are doing, all these things, and this is very important that if our family members are really learning this one, this is going to be very effective.
What I'm interested to know your perspective and opinion when it comes to, practicing those skills, active listening and engaging conversation. You know, now we kind of understood the basis of how important it is when it comes to our seniors. Um, I would like to know your perspective, how important it is to practice those same skills when it comes to, not people in seniority level, perhaps, younger children, from ages 10 to 13 hitting, adolescence, having those conversations, or even maybe even younger children, like toddlers as well. They go through their own world as,
Yeah,
every a child is in his own realm, They might be upset because they cannot play a video game or watch a cartoon,
yeah.
and they get frustrated and they want to be heard and known. Is it important to practice these things with younger children and then adolescents and then emerging adults as well?
Yeah, you know that whenever we are, for example, educating someone,
Mhm.
so according to the age and then perceiving power and other
Yeah.
things are always. So, children, when we are experiencing in healthcare setting, so some parents are from the day first, it is all related to our upbringing
Yeah.
and it is related to our education. We see even not only in Muslims but in Christians, in other places, where there is a very deep relation between grandchildren and seniors. And even some of the seniors, when I'm just making my assessment, so I come to know that when I'm asking them, because one of the questions we are asking, that our life is worth living or not. This is very important question. For example, everyone can ask why I am living, for whom, for
Yeah.
what is my purpose, what is meaningfulness, why I should not end my life. So similarly, when I'm asking, when you are becoming seniors, your options are becoming very limited.
Yeah.
Now you are young, so you have lot of options and choices. But as you are becoming older, your choices are going to be very, very limited physically and spiritually as well. So they are very focusing on their children, especially grandchildren, not even their own children. So they say we are living only for our
Children.
grandchildren. So, but parents, they have connected from the day first to their how to respect elders, how to be with them. And seniors, I mean, this is again another issue that sometimes seniors are not attaching children to themselves. It is another art and skill is required for us before we become skilled.
Yeah.
We should learn how to step into the children's world
Yeah.
and how to entertain them. Even I am 60, 70, 80 years old, but I know how to. I remember my grandmother about her, and she was very engaging,
Mhm.
and we would really take lot of interest and then lot of question, and we would feel that she's stepping into our life, not her perspective she is talking. So if seniors are like that, and because all of us are becoming seniors, so we should really uh, learn this art as well. So come to the point, children, there is a different like spiritual health perspective. Training is
Yeah.
required, education is required. But when parents are, they themselves are unaware of this kind of education, so definitely they are not doing with their children as well. So similarly, when you are becoming teenager, and then again parents, they should connect to their children. It's very ongoing efforts with children. It's not that, for example, whenever you are in good mood, you are educating them. All the time you have to tell them that what you need to do, how much you have to pay respect to each other, how much you have to appreciate each other. It is all about our moral and ethical and spiritual training at home.
MashaAllah. So big thing is self-education first.
Yeah,
And then once you educate yourself more, then you're able to give that back to both the
exactly.
generation
Yeah.
below you and the generation above you as well.
Yeah.
Inshallah. One more question I wanted to ask you. Don't worry, I know I had you for a long time. It's one of the last questions there, right? I'm engaging. I love this conversation and I'm enjoying it a lot myself. Is how was your educational career path exactly? So what pathway did you take in order to, attain the license to practice what you practice right now?
Yeah. So,
Like how many years was it? And then what pathway, as well as if you could tell some of the obstacles or some of the hurdles you went through, or some advice you give someone who wants to follow a similar pathway.
after completing my bachelor in mathematics, it was 1984, and then I went to Qum for religious study because my family was already religious, and my grandfather was also he was a great alim in India and Pakistan. So I already had the background. So I went to Qum and I started my education there. And then I stayed in Qom and I completed my education more than 12 and 13 years. So 12 and 13 years I was in Qom. I completed 3-4 years. I studied Dars Kharij as well. And then I also took admission in the University of Tehran. So I done my master's in Islamic philosophy and theology, which is called Ilahiyat. And then I done PhD from the same university in Islamic philosophy and theology. And then in total, it was 18-19 years I was in Iran. So I completed my study there, university. And the reason was I didn't want to become professional alim, but I wanted to become actually Islamic scholar. And I wanted to contribute in the universities. So this is why I became assistant professor in International Islamic University, Islamabad. And then I went to Germany. I was visiting professor in the University of Bonn. And then I came back to Islamabad. I was director general in the Council of Islamic Ideology. And then after that, when I came here, I started to provide my religious services at Az-Zahra Islamic Center. And at that time, when I started to lead the community, I came to understand and realize that this is not right thing. That, for example, our ulama, people, what kind of question they are asking related to counseling, psychology, they are ready to answer them. I was thinking, because my background was universities and professor and other thing. I said, no, this is not right thing. If I have not studied counseling, I should not provide counseling to, because I'm making them worse. And I have seen a lot of examples, but I can't say this one. So I decided to go and study counseling and psychology extensively. I studied psychology, like abnormal psychology, cultural psychology, adolescent psychology, health psychology. I completed all these courses in SFU and other universities. And then I also completed psychosocial rehabilitation diploma 2 years from the Douglas College. And then even president of Az-Zahra at that time, he said that you are the first one who is saying that I want to learn something. So I was very interested to get all this education. And then I was guided, I was happy that spiritual healthcare is a very, very professional field of study. And Christians, mostly they are there, but there is a tough education. So if I'm going to do this one, so I will be able to help Muslims also, and I will be able to learn this art and education. So then finally, it took very long time, and it was very difficult for me to take admission because it was really tough. So I got into this program, and then I completed all the levels, and then I found job because of this one, and then I started to provide spiritual health. And then I came to know, because I'm also teaching at very higher level in the medical universities in Tehran, in Mashhad, and in Isfahan as well. And doctors and specialists, they are also attending and coming in my lectures, and psychiatrists as well. So they really want to learn what spiritual care is, which is called in Persian muraqabat-e manavi. So I am also doing this one. And then once I have, for example, I am already providing this one spiritual care. I learned from there. And then what I want to say, I realize that in our countries, like in Asia, they have no concept at all about spiritual care. And there is a misunderstanding in Muslims that because I was only 4 years, I was just providing only spiritual care in Mankur General Hospital to the Muslims, Sunni, Shia, Qadiani, whosoever they are. And I have lot of experience, the issues of Muslim families and Muslim patients. And they are always thinking, oh, we believe in God, we believe in prophets, we are already Muslim, we are already praying. So we don't have any need of any spiritual care. But they don't understand actually what spiritual care is. So anyway, so after that, I really understood as a alim of the community, as a scholar of my fields, religious field, I first time came to know that even in understanding the Quran and understanding our imams, understanding our prophets, we are totally ignoring the spiritual aspect of the Quran. The way Quran is also teaching us spirituality and spiritual care and spiritual health, we are only, I started to understand from the Quran differently. So this is what my, for example, journeys. Yeah.
That's a long journey, mashallah. And overall, this is a career that you find yourself fully satisfied with, fulfilling.
Yeah, I'm not only fully satisfied, I'm very, really happy, and I'm very thankful to God that He has guided me to this path. And then I am proud of myself. And now my goal and aim is to really some other community members, they should come forward. They should also, as you also mentioned this one, I would say to you that you are already, your psychology is your major. Your education will be incomplete if you are not adding spiritual care. So this is always very important. So holistic approach is related to spiritual care, how we are paying attention to this specific dimension. So this is, yeah, what.
Mashallah. Alhamdulillah, thank you so much for today's session.
Thank you so much for inviting me.
No, of course. Now, before I let you go, there's one last question, and we ask this question to every single guest who comes on here. Okay. It's a very hard, difficult question.
Oh my God.
You have a mathematical background, so you'll be ready for it now. I'm joking. But the question I have for you is just, what's one piece of advice that you would leave our viewers with? I ask this question to everybody. It could be a quote.
It is really very difficult.
I know. So it's always on the spot. People, you want to take a second to think about it. It could be a quote, a hadith, a verse in the Quran, or, something, a piece of advice you're given that really you held on to throughout the years.
I think it is very important for us to learn that we have to make our assessment, and then we should provide care to ourselves. And then when we say that we have to have compassionate presence and without judgment, so we should do with ourselves as well. So without any judgment, we have to see that where we are standing and what are our deficiencies, what are our shortcomings. So if we are not aware of our shortcomings and deficiencies, then we cannot correct ourselves. And other things, we need to learn to become the seeker of truth. And truthfulness should be the main goal in our life.
Inshallah, mashallah. Thank you again, Doctor.
Thank you so much.
It's been a pleasure. Hopefully, we'll have you again soon for a part 2.
Thank you.
Inshallah ta'ala. Thank you again to all the viewers tuning in. Alhamdulillah, I've learned a lot, and inshallah you have too. Don't forget to like, comment, subscribe, and tune in within the next 2 weeks for our next episode, inshallah. Assalamu alaikum wa rahmatullah.